Hi everyone, this is Kate Warnock coming to you from the Guidewell UST Global Innovation Center here in Lake Nona. I'm delighted to have our next guest with us today, Dr. Charlotte Hovet. Charlotte, welcome to the interview.
Thank you, Kate.
Charlotte, you have a wonderful title. You are the Global Medical Director of Healthcare and Life Sciences at Dell. So let's talk here. We'll start here with a very obvious question. What brought you to the Greater Than Cancer event, and what might you be taking back to Dell?
Oh, great question. And I'm here, Kate, because I and my colleagues at Dell, we are committed to patient-centered, information-driven healthcare. And I'm still a board-certified, licensed family physician, and I combine that today with information technology so that we really can advance the care of all healthcare.
It's really an exciting time to be in medicine.
It is. It's a very exciting time to be in medicine.
And what a fantastic company that you work for, too,
Thank you.
to be able to drive
excellent.
that. So, obviously people know Dell from Dell Computers and everything,
right.
But why do large tech companies like yours need to be at the table when we talk about transforming healthcare?
Great. Well, I'm with Dell Services, and so Dell is hardware, it's software, and it's services. And services is about bringing new tools to healthcare providers and to patients. Today, to practice medicine in the 21st century, we need to use 21st century tools. And I think those of us at Dell Services, we're very committed to delivering care when and where people need it, which is in their homes, in their communities. And we need to use tools of technology to deliver care where and when people need it.
Right. Let's talk about that a little bit more, given the background of Dell Services. How is technology transforming the cancer care experience?
Well, in today's world, we are digitalizing the data. That's one area I want to focus on, is that there is a wealth of digitalized data out there today because of technology, because of the EHRs. But now we need to put that data to good use. We need to be able to share that data, integrate the data, analyze the data, and use it to have more precise diagnoses and treatments and actually deliver care. As I've said, where people need it, when they need it. They need it in their homes. They need to be surrounded by their families. We need to take new technologies such as e-visits and telemedicine and deliver it outside of the walls of the hospitals and the clinics. And technology is playing a huge role in that, in terms of basically bringing all that data, turning all that data into useful information, which then at the end of the day, it's about impacting both clinicians and patients' behaviors. It's about influencing their decision making so that we can make better decisions around diagnoses and treatments and care plans. And it's got to be a partnership. I strongly believe that we can transform the world of healthcare if we bring respect, compassion, and partnership to every healthcare encounter. And there's no question that today we need the alignment of people, process, and technology.
Absolutely. I love that that's your response, because so many of the themes that we have heard being discussed at Greater Than Cancer, our immersion event here, is the humanity behind the healthcare, and not forgetting the individual, their caregivers, their family, their extended community, and it certainly sounds like that's really at the core of your mission too.
Absolutely. Patient-centered care, which really is about valuing the preferences and the needs and the values of patients and their families. And then, as I've said, having shared decision-making, so that at the end of the day, it's really about optimizing the health and the well-being of the people we serve.
Terrific. All right, so Dr. Hovet, one last question for you. What do you think will have the greatest impact on the cancer patient experience in the next 5 years?
Over the next 5 years, I think it really is addressing the individual needs of patients and their families. Mm-hmm. It's really about, I think, bringing more respect and compassion. And the way we do that is give patients and their families the tools they need to be very informed and very interactive in their care plan. So I think it's empowering. It's empowering patients with the tools that they need to have the right information at their fingertips, at the point of care, and really empower them to be in charge of their care. Because I think for all patients, cancer patients, patients of chronic diseases, we have to be our own primary provider of our care plan. And so there's no question, I think technology is enabling patients to take that role.
That's wonderful. Well, thank you so much, and what a wonderful way to end our interview. So, Dr. Charlotte Hovet, thank you for your time. My name is Kate Warnock. Thank you for watching.